again for everybody joining. Really, really excited for this conversation today and really excited to kind of kick off our series for this year. It was an extraordinarily popular one last year. Over the year, we had about 3,000 participants throughout the 10 or so webinars that we had last year. So again, really excited to be doing it again this year. This conversation, we're going to focus on health and housing, not because they're both ages, but because they are so interconnected in the challenges that some of our communities face. So really excited to have experts from the hospital system, really excited to have experts from the policy space, really excited to have experts from the nonprofit space. So I think this is going to be a great conversation today and really looking forward to having it. If we jump to the next slide, if you've seen me present in the past, you'll notice this will look a little different. One more slide ahead. We actually have our senior economist joining us today. So I'm just going to give a little bit of a quick overview on a couple different things that the Chamber is working on, how you can get engaged with what we're doing, some programming and events that we have coming up before I hand it over to Sheridan Meek, our senior research economist, to kind of give the data overview to set the stage before we get started. So again, I like to give these brief overviews because the more and more I do it, the more people realize, like, oh, I didn't realize you guys were working in that space, or I didn't realize there was an avenue to do that. So the Florida Chamber of Commerce is primarily broken down into three different areas. We have our foundation, which of course is the team that I am on, as well as Sheridan and Zanani and many of those that you will hear today. And we are primarily working in the research, data analytics, incubation space. So all of the policy programming, all of the research that comes out of the Florida Chamber of Commerce actually starts and is done within the Florida Chamber Foundation. Primarily going to be talking about a few of the tools and a few of the projects that we're working on today. So the Florida Chamber of Commerce is that advocacy side of the House, and our political operations actually works to recruit and retain candidates in office. So again, everything from creating the idea in the beginning, matriculating it all the way through to policy passage, and actually making sure that those policy leaders are in place to pass those bills. It all happens here under this roof, just different floors of the building. If we jump to the next slide, wanted to note here, and please do reach out to me if you have any questions about either the topics or some of the tools that we're going to be showing off today. I was having a great call with somebody the other day who I've worked with for more than a year and a half, and they said, you know what, I want to learn how to use the gap map more in depth. And I said, that's fantastic. Like, don't be afraid to ask that question. It's an amazing tool, but if we don't know how to harness all of its ability, then we're not maximizing its usage in the community. So whether you have questions on the Florida Gap Map or the Florida Scorecard, you want to get engaged in things like the Prosperity Project or some of our workforce development issues, which, again, we'll talk about a little bit in that healthcare space, as many of our workforce development pieces are in healthcare right now. Feel free to reach out to myself or Zanani or anybody on the team, and we'll get you plugged in. We jump to the next slide here. Just want to kind of cover a few of the policy pieces that have happened in the past year and are still happening that relate to both health and housing. Very interesting, and again, not the reason we're kicking it off this year, but Senate President priorities the past 2 years have dealt with both housing and health. So last year, you may have heard of it, Live Local, SB 102, and there's some cleanup that's being done to it this year, but it was an extraordinarily positive bill that passed here in the state of Florida. It's bringing over $700 million into housing projects for the state in short order, which is the largest investment in our state's history. It incentivizes development through tax incentive. It reduces permitting and zoning requirements for affordable housing. And it really kind of creates a system where more individuals in our low income and even through our ALICE households can get access to capital, whether it be a down payment assistance, or housing assistance in and of itself. So really a very, very positive bill to support one of the greatest challenges that we're facing right now in the state of Florida, which is affordable housing. Now, we're not unique. Every state in the country is facing this issue, but I think we're unique in the sense that we are addressing it head on. We are talking about it very openly in every presentation. You'll hear about it today, how unaffordable housing is in Florida right now. And again, it's not to say that that's a negative. It's to say we have to confront these realities if we're looking to overcome them. We jump to the next slide here, another one, and again, kind of on that same ideology of Live Local, we have Live Healthy this year, which is SB 7016. It expands medical residency slots to increase the number of physicians in Florida. We've been dealing with physician shortages in the state for more than a decade, and they continue to build on themselves. And it's also key to remember, our 65-plus community is growing fairly rapidly in Florida. which can be a great thing. It can bring a lot of income into the state. It can bring a lot of capital into the state. But if we don't have the infrastructure in place, like those physicians, to support that community, we're going to be in real trouble, and those individuals will stop coming after a while. It creates training and education programs. It removes barriers for experienced, trained physicians to practice within the state. It expands our reimbursement rates for medical and dental education. Again, it's just a progressive bill in the sense that it looks at everything from how are we training our workforce all the way through how we are actually dealing with some of those health crises that we're facing in the state. So really excited to see this bill moving through the legislature and have a lot of hopes for it as we come towards the end. And then one last slide here on the very end. Just wanted to highlight, if you are able to join us, please join us at our upcoming Prosperity Summit in May down in Fort Lauderdale, Florida, or I should say Coral Springs. Or, I should say, join us in June in Tampa at our Learners to Earners Workforce Solutions Summit. Two really great events. Excited about the content that we're crafting together. We're about a couple weeks away from actually formally posting the agenda online for the Prosperity Summit, and just right behind there, we'll have the Learners to Earners Summit as well. But I had a really cool speaker prep call yesterday, and really excited about some of the content and some of the leaders that we're bringing to the table on these events. So, without further ado, I do want to kick it over to the content portion of this event and get it kicked off with Sheridan Meek, our Senior Research Economist here at the Florida. Sheridan?
Awesome. Thank you, Kyle. So I'm going to talk a little bit more of the data side of health and housing metrics in Florida. So you can skip to the next slide. So before we dive specifically into health and housing, just to give some context to the work we do at the Florida Chamber Foundation, we have a lot of resources that are free data resources that help you to look at data at the state and also at the county level. So looking at economic indicators, we know that health and housing have an impact on economics and are economic indicators, but some of the other things, we look a lot at the net new jobs that are going to be needed in Florida by 2030. We know that Florida's population is growing rapidly, so we keep that up to date every month. Right now it's 1.22 million net new jobs. We have a tight labor market in Florida right now. So open jobs has declined, but the number of unemployed people has increased. So that has kind of closed that gap and made there a little more balance in that labor market. The unemployment rate has increased to 3%, but that's still substantially lower than the national level and many states in the country. Consumer sentiment is something that measures Floridians' outlook on the economy. So how are Floridians viewing the economy, which then can impact things like their spending. So we keep up to date with that on the scorecard. And then finally, the housing market, which I'm going to dive into in a little bit. Next slide. So as I said, Florida has a very tight labor market. There are currently more open jobs than people who are looking for work. So that breaks down to about, for every 100 open jobs, there are 91 Floridians who are looking for work. And that's evidence of a workforce shortage. So it has improved over the last few months. At one point, it was as low about 60 people for every 100 open jobs. But it's important to mention that these statistics come from, at least the open job statistics, come from online job postings. And so that means that this is even an underestimate of how many open jobs there are in the state, because not every open job is posted online. And also, because there are 91 unemployed people for every 100 open jobs, that doesn't mean that those 91 people are qualified for those open jobs, because we have not only a talent shortage, but also a skills gap. So those people might not necessarily be the right match. They also might not live where the open jobs are. So when we're going to talk about housing, a big factor in that is if people can afford to live where the jobs are for them to work. If you get a little bit more zoomed in, you can look at this by the county. We have this by the county on scorecard. So in some counties, there are more unemployed people than open jobs, like Flagler County. But in most cases, the workforce shortage is even larger than it is at the state level. So for example, in Leon County, there are 55 unemployed people seeking work for every 100 open jobs. You can go to the next slide. And a big part of that is Florida's aging population. So specifically, as we look ahead to 2024, just an example of this, the age range of 20 to 65, that makes up 56% of Florida's population right now. And we're going to add about 61,000 people in that age range over the next year. And then if we look at the age 70 plus, we're going to add about 16,000 people, or that's about 16% of Florida's current population. And we're going to add 70,000 people. So we're going to add even more in that 16% of our population than we're going to add in the 60% of our population range. And we're actually going to decline in some specific age ranges. So ages 9 and under, ages 25 to 35, and then ages 50 to 60. And those are key areas because ages 25 to 35 is Florida's new talent. So when we look at that workforce shortage, these are the new people coming into the state, aging up into that workforce age. And then we also have ages 50 to 60, which is in those management and leadership roles, and those are the top GDP contributors. So we're looking at these age ranges. A big contributing factor to that is the fact that people might be moving out of the state because it's not as affordable of a place to live. So people ages 25 to 35, new in their career, might not be able to afford it. And then ages 50 to 60 might be taking advantage of the housing market and selling their home now and moving somewhere that's a little bit more affordable. Next slide. So Florida's home prices have been increasing rapidly over the past few years. So some context to that, over a 2-year period, the median sale price of a home, a single-family home, increased 53%, but the median household income only increased 20%. You can't look at this and just say it's inflation. The value of the homes have increased even more so than what people can afford because of what they're earning with their income. So that huge increase in relative cost, that's led to 53.8% of Floridians being housing cost burden. So that means that they're spending 30% or more of their income on housing. So looking at today's median prices, the median listing price for a home in Florida is almost $460,000. If we look at back to 2020, February of 2020, it was closer, it was in the 200,000s. So it's grown rapidly over that 50%. And to get a bigger picture, we also can look at rent. So rent is over $1,500 for the median rental estimate. When you look at some different regions, some different estimates, it can get as high as $2,000 just for the median rental estimate. And so median sale prices, looking back all the way to 2018, median sale prices were pretty consistent until about February of 2022, while active listings were seeing steep drops. However, when those interest rates rose, when they climbed above 4%, active listings caught up because not everyone was rushing to buy a house when those prices are so big. So active listings increased and slowly prices started to climb as well. So that active listings is actually a leading indicator in that area. Next slide. So of course, this all varies by area, county, but also community. So when we look at the zip code level, at the county level, we can see this statistic, this housing cost burden at the county level, but then the Florida Gap Map has this down to the zip code level. So just 2 zip codes as an example. These are in Leon County. So in Leon County, 53.6% of people are housing cost burden. But if you look at 32304, it's 66.2%. But then just in closely neighboring county, 32312, it's actually less than it is on average in the county. So you can see here that difference in percentage housing cost burden can happen even in counties that are really close to each other. And that's a lot of the value of the Gap Map, to be able to see down to the zip code levels, and that goes down to the community level. Next slide. Some of the, just the high level, talking about the importance of housing and how it impacts health. So if housing is not affordable, many people are paying that 30% or more on their income, and that leaves less income to spend on things like healthy foods that are often less affordable than non-healthy foods, or less to pay for healthcare. And then if you look at instability, so if housing is not affordable, then that can lead to housing instability. People are moving constantly because they cannot afford the homes they're renting or in, and that can lead to some struggles with mental health, as adults, even kids, often are struggling with having to move to different homes, always being on the move and going to different counties, different areas, being surrounded by a different community. That can lead to mental health struggles. And then also neighborhoods. So often neighborhoods that have more access to things like public transportation or grocery stores with healthy options, those are less affordable places to live. And all of those things then come around and impact the health. So next slide. Just seeing kind of these numbers, putting those numbers to that impact and that cycle. Again, looking at that 32304 and 32312. In 32304, has a higher percentage of people who are housing cost burden, and it also sees double the percentage of people reporting poor mental health, and a smaller percentage of people that are having routine doctor and dental visits. And then you look at 32312, and that has a lower percentage of people in poverty and who are housing cost burdened. And a much smaller portion of the community in 32312 is experiencing poor mental health or going without those routine and doctor visits and dental care. So this isn't necessarily attributed as a causation, but there's clearly a correlation here. So no matter where the cycle starts, it is a cycle. Health and housing, we're seeing here in these numbers that they can't be looked at alone because they're clearly not standing alone as we're seeing those high numbers in one community and then low numbers in the other communities. So yeah, we're going to dive a lot more into those metrics, but that's some of the high-level data. So I'll pass it back to you, Kyle.
Thank you, Sheridan. I really appreciate that. And I think it just kind of gives us a good perspective on how much of a challenge we face. But on top of that, how feasible it is to come up with some solutions. Again, we talked about these as statewide issues, and they are certainly. But I think things like the gap map and some of the data analytics we do says, look, we don't need to do it in every single community in the state, though. If we target our resources, if we're really thoughtful and effective with how we bring those resources to life, we can come out with some really interesting solutions. So one person I'm really excited to kind of bring to the forefront here and have a conversation with today is one of those leaders when it comes to solutions. It's Ashawn Nesbitt, the Chief Executive Officer of the Florida Housing Coalition. Ashawn, just before we even get started, thanks for joining today. I really appreciate it as a goal leader.
Thank you for having me, Kyle. Excuse me, just getting over a cold, but very, very excited to be here this morning.
Well, thank you even more so for being here then. The sickness is going around my family as well right now, so I'm fortunate that I avoided it so far. Hopefully we'll continue to do so. Look, Ashawn, before we even kind of dive into, I think, some of the specifics I want to cover today, can you just give us a little bit of an overview of who the Florida Housing Coalition is for those on the call that may not be familiar with your organization?
For sure. And once again, very excited to be here and happy to be with the Florida Chamber as 2030 goal leader. And for those of you who aren't familiar with the Florida Housing Coalition, we are 40 or 40 plus year old statewide nonprofit. We exist. Our big mission is to work to bring together our resources, advocates, everyone around the issue of affordable housing, because we want to see every Floridian have access to a house or a home that's affordable to them in the place they live, in a suitable living environment. And for the last 30 plus years, we've really focused in what we do around training, technical assistance, consulting, working with local governments, nonprofits. We really exist to kind of build up and boost the housing ecosystem here in the state of Florida through spreading good knowledge, good best practices, all of the tools, and really being that knowledge resource so that you all in your local communities can do good work and implement strategies that work best in your local context.
And I really appreciate that. And for those who maybe aren't familiar with our setup here at the Florida Chamber Foundation, Florida 2030 Blueprint is all aimed at how do we build the 10th largest economy in the world by 2030. We have goal leaders for all of the 39 goals that we think need to be accomplished to reach that 10th largest economy in the world. And what we've done with those goal leaders, identified who are the experts in the space, who are the thought leaders, who are the people who are moving the needle across the three sectors, the business, philanthropic, and policy community. And obviously the Florida Housing Coalition was a common sense partner in that respect. So we really do appreciate your leadership, and it's been great working with you over the past few years, and it's great to continue working with you as we try to diagnose and assess what is going on with affordable housing across Florida, and more importantly, what solutions we can bring to the table. So we heard from Sheridan a little bit on kind of the data side of where we stand today. But if you could give us kind of like a little bit of an overview, and again, whether you want to do it from a data perspective or the conversations that are being had, what is the current landscape of affordable housing in Florida, and what are some of those most pressing challenges that we're seeing across our communities?
Yeah, that was a fantastic data overview. Really, leads the conversation. And just kind of speak from a market standpoint, and really we know Florida is a popular state for folks to move to, and we really saw an uptick in that in the last couple of years. And so, and we can look back many years ago, we've seen kind of production not keep up with demand. But we definitely have seen that spike in demand as more people are moving to the state. And, most of our markets are responding more so to that group. And then we have the workforce that's here. And so, our workforce has historically been, lower income jobs, service related jobs. And that's diversifying in a lot of places. But, that has to catch up to what the market is producing. And so we're kind of seeing that mismatch in, what the market's producing that's really kind of targeting those that are moving to that may be more well resourced compared to the workforce that's here that's servicing that population. And we're seeing that in every market. It used to be really kind of confined to our big major markets, but folks are moving to our mid-sized markets. Even smaller rural communities are starting to see that pressure, that same pressure that was mostly confined to bigger markets, as well as the instability kind of reaching the higher incomes, as those prices go up. And so, that's really kind of the statewide view, is that, it's not just a Tampa problem or a Miami problem. It's a Lake City problem. It's a Live Oak problem. And so, that's really, I think, the difference now is that, everybody's seeing that and everybody's now attention is on it. So I think it's a great opportunity to kind of galvanize this energy around this issue to bring forth some really positive results.
Yeah, I love the way you framed it, because it's a similar conversation we've been having at our office a lot recently, and having from stage where we're speaking at various events. There was, I think, this massive concern, and I harken back to a conversation that Mark Wilson and I, our president and CEO, had. At no lie, it was almost 3 years ago to the day, where a report had come out on CNBC about all of the tech people moving to Miami, during COVID kind of lockdowns in other states and stuff. And he said, we need to really be careful that Miami doesn't turn into San Francisco. And by the way, this is not a diatribe against San Francisco. I love the city. I think it's a beautiful city, great food, great people, but it costs $1 million+ to get a 2-bedroom home there. So it's not an affordable place to live. And I said at the time, it's fantastic that we are bringing all this migration, this wealth migration into the state, and we lead the state in wealth migration, or lead the nation, I'm sorry, in wealth migration. But we need to prepare an infrastructure around that. And I think your point of we were building to those that were moving here and stopped building to a degree for those that were here is a massive problem. And you see it in Sheridan's bullet points at the onset. We're losing population in 2024 in the age of 25 to 35. And that should be the 5-alarm fire. That should be the wake-up call for everybody going, oh my God, this is broken. Something has to be fixed. And again, I want to know, this is not just a Florida-specific issue, but if we acknowledge it in Florida and we build infrastructure around fixing it, I think we can be ahead of the curve. So I like the way you put that. When it comes to kind of addressing some of these issues, I think it can be complex. Talk to us a little bit about some of the partnerships that you guys have all curated, the work that you do with local government, private sector nonprofits to kind of enhance what it looks like to access affordable housing across Florida.
Sure. I mean, we at the same time, we have the envy of the nation with our Sadowski Housing Trust Fund, with its dedicated funding source. And so, a lot of places wish they had that. And, we have that. And because we've had that, for 30 years, we really built infrastructure in local governments, even in smaller places that wouldn't otherwise exist, in order to get funding out to address housing issues, whether it's, rental housing or it's, rehabbing existing housing, that infrastructure is there in every community in the state. And so we really should be very proud of that. And, we work to support that, through training, free training, every year throughout the year. And so, really, if you look at what that stands for, State Housing Initiatives Partnerships, it really is about creating those public-private partnerships. And so, with that, of course, the nonprofit communities, and, we work to empower them, to make sure that they're ready for the opportunities that come their way in terms of development. And we have a very solid core of, for-profit developers that are working to build rental housing. And so, we really have a lot of folks that are already in the ground that have been working in this space for years, that have, great capacity. And I think it was a great timing last year to have that infusion of money, but also tools and resources through the Live Local Act, to bring more folks to the table. And so, we're already seeing that with a lot of the traditional market rate developers that are coming to the table now and saying, we want to get or we can get into the affordable space because the incentives are there to make it work. And so, we're really excited about what the Live Local Act will do in terms of that. And I think we're just kind of at the tip of that. It just came out last year, so we're going to see how that works, over these next 10 years for sure, with additional funding to do some transformative things. And so I think, all the tools are in place. It just takes time to get things going. Real estate development just takes time generally. And so I think the missing piece next is, how do we expedite production, whether that's through, factory built or, other things that can really speed up the process of producing housing, because we have the people, we have the resources there. We just need to speed it up.
Yeah, agreed 100%. Want to touch on another point of housing, which I think has been one that is maybe going under discussed, but I think is just as important as any other component when we're having this conversation. And that's this idea of the resources and the opportunities around the housing. As I was describing with somebody when some policy was getting put together over the past year or so, we were talking about affordable housing and its location, and they said, well, we just need to build more houses at this price point. And I said, kind of, that's part of it. But let's be very, very cognizant of where these houses are located, what access it has to resources around it. If you build a cheap home where there's no transportation, no jobs, no education, you build a cheap home that nobody can afford to live in. And again, I think that's where affordability comes into the equation. So talk to us a little bit about all the other components that have nothing to do with building the house itself, but are so important to maintaining the house being affordable.
Sure. I mean, you touched on a big one is location. Location where, of course, as close to the job as possible, or where there's access to transportation to get the job. So you have the option of you driving or not driving. We talk about the cost of owning a car, insurance, all of that kind of factors into that. And, when we used to say drive till you qualify for a house. And a lot of times that's what folks do. And then you end up, you may have moved when you were 20 minutes from your job where you were renting, and now you're an hour away from the job, but you own. And so, you really don't, save. And so,
Right.
you have that happening. Being close to a grocery store, being close to your where your kids can go to school, all of those things, factor. Being close to a support system that you need with family and friends, and wanting to stay in the community. A lot of folks, they move, you're young, you're living in the city, you built your friendships, and then, now you have to leave that support system to move somewhere else. So all of those things I think are super important to making things work and making things maintainable. And of course, you can afford the mortgage, for example, if you're buying, but there's the cost of maintaining that home over time, insurance, taxes, saving for that roof that's going to need to be replaced, in 15 years, or, all of those things are important. So, that has to be factored into the cost of, the affordability of that home. And so, there's a lot around that. And so, yeah, it's definitely a complex web of things that go into, what truly makes things affordable other than just the rent or just the mortgage payment itself.
Yeah. And I think that was some of the beauty of some of the work that was done within Live Local. Again, realizing that we maybe need to build up in some of our communities, or we need to for lack of a better word, almost like reappropriate dilapidated property and rejuvenate it so it can become housing, because it's still great property in and of itself. One other thing, and kind of one of the last notes I want to touch on here is, at the end of the day, I think the progress we've seen over the last year is extraordinarily positive, but our housing challenges aren't going to go away just because these policies are passed. There's more efforts that'll need to be done. And by the way, just like everything in life, there's something next on the horizon. We're going to face more challenges in the future. And I think that shouldn't be meant to scare. That shouldn't be said to scare people. It should be said in a way that, hey, we're going to face challenges, but we have different outlets to resolve these challenges and come up with solutions. So talk to us a little bit about how business and philanthropic leaders can get engaged with the work that you all are doing, learn from the work that you all are doing, be supportive of the work that you all are doing, and ultimately, kind of having us all come together so we're united on an effort headed in the same way to address these affordable housing crises that we're facing.
Yeah, thanks for that question. And you said it right. I think, just realizing we didn't get here overnight. This was decades in the making, and it's going to take some time to get where we want to go. I think the biggest thing that our business communities can do is just really to be advocates, in your local community just for housing, and to understand how it impacts your own employees, to give you that extra fuel to be those local advocates, and to support those that are already doing the work. Whether that's showing up for a meeting to say we support this housing development because it's going to benefit our employees and benefit our community, or supporting nonprofits by being on boards, contributing financially if you're able to do so. There's all kinds of things that we can do to really build up the capacity of those that are already doing the work. And also to look at your own resources, and I started low, I'm going to go up to the top. Look at your own resources. We heard recently of a furniture manufacturer in Ocala that has some additional land, and they donated that land, and now there's workforce housing being built on that land, and it's directly across the street from the factory. And so the workers at the furniture dealer can work and live across the street. And so you might have those things, and you don't have to be the developer, but if you have that resource, you can make those resources available, and you don't have to be Disney or Universal to do it. You can do it on a small scale that works for your community. And so there's lots of things that folks can do. Find out, get in touch with your local housing folks if you just want to say, we just want to know how we can get involved, and that's always a good resource. Or they can always call the Florida Housing Coalition, and we can definitely talk with you and make those connections to you in your local community, because there's lots of things that folks can do.
Sean, I think that's such a fantastic point to leave it on, because again, there are solutions that are at all sizes, and anybody can be part of that solution. And we've seen people use the gap map to target their efforts to be more fruitful, and it's been incredible. And Tim Marks at Metropolitan Ministries, an amazing leader down in the Tampa Bay area, when he went into the gap map with his team at first, he saw that 25% of their housing resources were going into the greatest areas of need. And they, I think, had gotten to a point where they're focused on scale and not impact. Not that it wasn't having a positive impact, it certainly was, but then they reformulated it using the gap map. Now more than 70% of their housing resources go into those communities of need, and they're seeing such a dramatic change in outcomes. So again, if you're sitting there saying, yeah, to the same point, I'm not a Fortune 500 company that can build, 15,000 units. You don't need to be. Reach out to our team, reach out to Ishan's team. We can tell you where there's the greatest need. We can point you in the direction of who's doing the work already to combine resources. And hopefully we can come up with some really scalable solutions. So, Ishan, thank you again so much for joining. I really do appreciate it. You and I obviously are going to have a lot more conversations, but anybody who wants to get engaged with us on this housing effort, please feel free to reach out, and we'll find some time to connect.
Thank you, Kyle. Always a pleasure.
Thank you. Well, again, this is a health and housing conversation. So without further ado, and make sure we stay on time, I'm going to kick it right over to my colleague, Zanani Johnson, to lead our conversation on health.
Thank you so much, Kyle. I really enjoyed you and Ishan's segment because I was reading the Florida Housing Coalition's one of their recent reports, and in there it states how housing is healthcare. So I couldn't be more excited to be moderating this upcoming segment with three dynamic women from the Tallahassee Memorial Hospital, Afaf, Kristen, and Kelly. I really want to give you all a chance to introduce yourself. So here you all go. Here's the floor.
Thank you, Zanani. We're also excited to be here from TMH. My name is Afaf Kasem, and I'm the Director of Health Promotion.
Looks like there. Hi, Zanani. Sorry, I thought I was unmuted. Yes, we are all excited to be here. My name is Kristen Booker. I'm Director of Regional Development, Population Health, and Telehealth at Tallahassee Memorial.
And my name is Kelly Leffler, and I'm the Manager of Population Health for Tallahassee Memorial Healthcare.
Well, thank you all so much. Kristen, I want to go ahead and kick it off with you. Can you dive a little bit deeper into an overview of Tallahassee Memorial Hospital's mission and you all's key initiatives aimed at improving health outcomes in our local communities?
Of course. So TMH's mission is transforming care, advancing health, and improving lives. So as you can imagine, improving the health outcomes in our local community is core to that mission and our vision. And being a nonprofit hospital in Tallahassee and Leon County, we have quite a few initiatives going on. So we have a large footprint that covers more than just Tallahassee proper and Leon County. Some of those initiatives, of course, is our community needs health assessment. So we refer to that as the China. And I'm not going to go in too much detail because that is a FAFSA. She oversees all of that. So, and she's done a great job. So I'll let her talk about that in more detail. But it is something that as a nonprofit hospital, we are required to conduct a China and create an implementation strategy every 3 years. And so we do an assessment, and these assessments help us identify the health concerns and barriers in our Leon County, but also some of the surrounding areas. The most recent one was done in 2022. And then our department houses what's called the Transition Center. So Kelly and Afaf and I, that's very dear to our hearts and very special. And some people in Tallahassee may know about the Transition Center, but there's a lot of people that are not aware that it exists. But it's an outpatient clinic that opened up 13 years ago. Actually, we just celebrated on Valentine's Day, our 13-year anniversary. But originally it was a collaboration between TMH, Capital Health Plan, and the Florida State University College of Medicine. And so the purpose of the Transition Center was to serve as a place where patients who were being discharged could go that don't have a medical home. So you have patients that come in that have just never developed a relationship with a primary care provider, or they have, but they're just unable to get into that PCP in the window that they need to continue the care that they need. So it's a really unique clinic. We have a social worker on site. We have a pharmacist on site. We have 2 providers. So we have a nurse practitioner and a doctor who are able to see the patients. But when a patient comes in, they will talk to the provider regarding medical concerns. But if while they're there, they have medication questions or maybe need a prescription during that transition time before they can get to their PCP, they can meet with our pharmacist. And then if there are other issues, social issues, maybe that they're facing, whether that's food insecurity, housing issues, transportation, then they can meet with Brandy, our social worker, and she can provide them with some resources. We work really closely with 211 Big Bend. And so she's able to not only get them an appointment with the primary care and get them established, but help with those needs as well. And then something that we are also doing at the hospital. So for a while now, we've been screening for food insecurity in our inpatient setting. So if a patient is admitted to the hospital, one of the questions that the nurses would ask them is if they are facing any issues with being able to have access to healthy food or just to buy food in general. You know, are they going without food? And if they screened positive for that, then they were meeting and still are meeting with a clinical dietitian in the hospital so that they can talk about what they're facing and then also give them some community resources there. You know, some of the like Second Harvest, and some of the other resources in our community. So recently, Centers for Medicare and Medicaid Services are wanting hospitals to screen for the social determinants of health. And so we have added more screening questions. So in addition to that food insecurity, we are screening for housing concerns, utility issues, maybe not being able to pay for your utilities, interpersonal safety, and then transportation. Transportation is a huge concern for a lot of people. So even if you're able to make an appointment to get in or go somewhere, if you don't have transportation for that day, then obviously you're not able to get to the appointments that you need. So when they screen positive, then our case management can meet with them and again provide them with a pamphlet showing them, what resources exist in the community. So again, 211 Big Bend plays a huge part. They're such a great partner that we have, being able to help when they're being discharged with these needs. And then another one, we have many, so I'm not gonna take up the whole time. But we also collaborate with other payers and providers in our community to address readmission to the hospital. So we do see patients that have some chronic medical diagnoses that they're dealing with. And if they're not able to get the care that they need when they are discharged, then it's very likely that they're going to come back to the hospital. And it's the healthcare access issue, but also those social needs that we were just discussing. I mean, they all work together to be able to provide the best health outcome for the patient. So we're constantly meeting and talking about how can we help avoid this? What can we provide? So, there's obviously telehealth visits, there's remote patient monitoring, which is something that also falls in our department that Kelly will probably touch base on. But just trying to figure out ways to stay on top of these patients so that we can provide additional help that they need to stay healthy. And then we work really closely with our TMH Foundation to search for grant opportunities. There's so many things that we would love to do in this community that obviously money is an issue. We can't financially do all the things that we want to, but there are some great grants that are out there to provide us with that additional funding so that we can help meet the needs in a better way.
Well, thank you so much for informing us of all that TMH is doing. And in your responses and just letting us know, you said a lot about community. And so that's what my next question is going to touch on. Afab, do you mind letting us know why it is important for businesses, including healthcare providers, to be actively involved in their communities, and why Tallahassee Memorial Hospital believes in community engagement and how it actively contributes to enhancing the quality of life of Tallahassee and beyond outside of Tallahassee?
Absolutely. I think you can tell from Kristen's response that community engagement is at the heart of what we do. And one thing that she mentioned was a community health needs assessment. And our community health needs assessment involves everyone. It's not just something TMH does just in one entity and goes out and tries to assess the community. It really has to do with businesses and organizations coming together to help us really address the challenges and needs of our community. So I'm going to go into detail as to what that looks like for us. So we essentially every 3 years go out into the community and collect a ton of data, primary and secondary data, of course, that was provided for us by the state. And we share that with the community. We tell them, here's what our populations say that their concerns are, their needs are, their health issues are. We also meet with stakeholders, county officials, health officials, to really understand and get that story in each of the 4 communities. So it's Leon, Gadsden, Wakulla, and Jefferson County. And that's because that's who utilizes the hospital the most, is coming from those 4 counties. And this is a requirement by the IRS for nonprofit status. And now you could see why it's so important, right? For us to address the health needs of our community and then come up with an implementation plan to address those needs. So I'm just going to dive really surface level into what those 5 areas are that we're working on over the next 2 to 3 years. It's access to health services, mental health and substance abuse, clinical preventive services, nutrition, physical activity and obesity, and maternal, infant, and child health. So we have groups that work with organizations outside of the hospital to address these needs, whether it's for a systematic change that's happening internal that will affect external from like clinical to community, or it's an actual program happening in the community. And we partner with tons of organizations to help us do that. So I think it's really important to note that it's coming together to address the issue because we know we can't solve it by ourselves. Oh, and I know you put in the chat box. If anybody is curious and wants to learn more about the China or has any more questions, I'm sure we can answer if you read our lovely over 120-page document. But teamh.org/China is where you can find those resources.
Okay, and Afaf, I heard you say that with the community health needs assessment, you go out into the community and you listen to what their needs are, and then you go into an implementation phase. Now, I read some of the community health needs assessment, and I saw the Southside Garden Project. That caught my eye because I thought it was innovative, but also because I'm from the south side of Tallahassee. So can you tell us more about how that came to life and how it's doing now?
Absolutely. So in 2018, the city of Tallahassee, TMH, FAMU came together and created a Southside Farmers Market, in addition to the Fresh Fruit and Vegetable Prescription Program. So obviously the Farmers Market was there to improve access to healthy food. So that's an initiative as part of our China. We want to make sure that communities are getting fresh fruits and vegetables and that they're accessible to them. Well, the city neighborhood divisions was also very concerned with the same thing. So why not come together instead of working in silos on the concerns that we have for our communities? So they offer fresh fruit and vegetable for purchase, and also it's obviously more affordable with local farmers. They also offer a fruit and vegetable prescription program where people from the community can come and attend classes on nutrition, cooking, learn about skills. Sometimes there are things at the farmers market. People might be curious and say, I've really never prepared anything with that. So it might be a produce item from the market that they'll use in these classes, and participants come and actually get a voucher. $15, I mean, it was $20, but it depends on what's available funding wise. But every time they come to class, they get a voucher as long as they attend it at the market. So then they can also use those dollars to purchase the fruits and vegetables from the market. So this program is still going on. We've actually added another partner, Second Harvest of the Big Bend. They've actually taken over on the nutrition education. They teach their curriculum as part of that program. And so it's thriving. Of course, with every program, there are barriers, especially a program since 2018. They're going to work out the kinks as we go, but I would say it's definitely still working. There's still available funding to support the series where people can actually learn about nutrition and cooking. So we're excited that this is a program that the city was able to sustain and manage, and they're always looking for ways to improve it. So this is one that's super important to TMH as well.
Well, thank you, Afaf, for letting us know. And I like how you mentioned the importance of not working in silos. And in all honesty, we're in like this new age of technology, whether that be AI, Zoom, we're on a webinar right now. So Kelly, I want to talk to you about how technology is rapidly transforming the healthcare landscape, but I want to know how Tallahassee Memorial Hospital is leveraging this and how they're using these new technologies to improve patient care and what its overall impacts have had on health outcomes.
Absolutely. So we're leveraging state-of-the-art technologies every day at TMH, and at really every level of our organization. We're excited that we're strengthening our relationship with Florida State University and advancing their research and really proving the patient outcomes with the new technology. But for this conversation, I want to focus on our new remote patient monitoring technology. So this program provides patients with really simple technology that allows them to share their vital signs and their health concerns with their healthcare team on a daily basis. So when health measures begin to trend in ranges that are outside of the goals that are set for the patient, we're able to provide support and intervention early, rather than waiting for it to require an emergency room visit or a hospitalization. We're also working to expand the use of continuous glucose monitoring in our primary care practices. So this technology was once limited to specialized endocrinology practices, but the technology helps to provide real-time blood sugar feedback to patients and their providers and give them real-time information on how their diabetes is being controlled. We know that increased blood sugar control can prevent or slow complications of the diabetes. That may be problems with eyesight, with kidneys, with the cardiovascular systems, your heart, vascular systems that may result in amputation. And these complications can be life-altering and financially devastating for our patients and their families. So prevention and early intervention is key, and these technologies help us with that.
Yes.
A lot of our healthcare model has revolved around periodic doctor visits that can be months apart. And so behavior change is really hard to maintain on our own when we don't have this level of support. So with this technology, we're able to support over time and help patients with their healthcare journeys. And I think this is important too, because many of our habits including our health habits, are passed down between families and between generations. So using technologies like remote patient monitoring and continuous glucose monitoring could have impacts for generations to come.
No, that's the truth. So, looking ahead, what emerging trends or technologies is Tallahassee Memorial Hospital excited about? And how do you plan to integrate these things into your services to meet the continuous evolving needs of the community?
Absolutely. So one of the things that we're really excited about is our new electronic medical record system that will be coming to our hospital in March of 2025. And the technology is Epic EMR. But the reason I'm excited about this is because it will begin to transform the way that our patients are able to interact with their own healthcare information. They'll have access to diagnostic reports, to their physician's notes, and really to the healthcare information that they need in order to increase their health literacy. It'll also help us to improve the communication between providers, both inside and outside of our healthcare system. So if you're receiving care in a connected hospital in Tampa or Jacksonville or Orlando or here in Tallahassee, you and your provider will be able to better track and coordinate your healthcare over time. Yeah.
Okay, well, that's great. And I can't wait to see how this continues to help our communities thrive, because hearing the constant collaboration, whether that be with Second Harvest, even with some of the ways that you all are engaging with us at the chamber, even with the farmers market, it's just exceptional. So I want to end it off with a bonus question, a fire round ending. So in an area where social responsibility is increasingly becoming a benchmark for business success, such as addressing childhood poverty, which is the work that I have the privilege of working on daily, and ensuring community health are critical challenges that demand attention, can you please discuss why it's essential for companies, regardless of their industry, to care more about the ways to find ways to contribute to solving childhood poverty? Furthermore, why should businesses proactively seek roles in supporting and ensuring the health and well-being of communities they operate in? I know that's a loaded question, but I think it's important to touch on because that's the reason we're here on this webinar today. And I'll start with you, Kristen.
No, I think it's extremely important. I'm going to kind of start with the childhood poverty part, right? So, it can be a cycle, and if we can work together as a community, including businesses and organizations, nonprofit or for profit, then hopefully we can focus on our children and teach them the importance of healthcare and make sure that they have the tools that they need with the social determinants help so that they can then teach their children and so forth, that they are the future of this state. And so we want to make sure that we're starting there. And it takes a village, right? It takes a village to raise a child, but it takes a community effort to help increase their quality of life and definitely their health outcomes. And I think TMH does it as much as it can do, but it truly does depend on others in the community.
Afaf?
I'll just add to that and say that a part of the China, I keep referencing back all the work that the community has put into this lovely document, but we collect, demographics, educational attainment, income level, and we share health outcomes and health statuses of our community and what they've shared with us. In hopes that these businesses and organizations will also take a look at our data, whether it's primary that we collected or pulled from stats that's available to us at the state level, so they could see the story we're trying to tell and take a part of that, right? Take ownership and say, okay, if our education attainment in this county is this low or income level is this low, how can we contribute our funding efforts, our grant initiatives? A lot of times people will use our data to apply for grants and say, we looked at the education attainment, we looked at health status, we looked at demographics, here's how we can help. And that's what organizations have told us, that they have benefited from our data for those reasons. So we hope to continue to contribute to that, because we know, like Kristen said, it's a cycle and we have to try to break the cycle. And the way to do that too, though, is getting to the root cause. And I know we can't do that alone as a healthcare organization. We need our partners, especially the ones that are focused on the education segment, to start as early as pre-K, kindergarten, and sometimes even developmentally earlier than that. There are stats we hear a lot of times about reading levels in third grade and how that can predict people's future. So how can we contribute to that? We can continue to share health outcomes. We can continue to share educational attainment of different counties, and to show, like, okay, if we know that this county has a lower educational attainment, how can we help that county? How can we support them? So if we're seeing these alarming statistics, we're not just sitting by. We're taking this data and we're applying for grants. And us as a healthcare organization can still contribute to that, because we know all those things can affect health outcomes. Access to healthcare has something to do with all of those things. So I think it's a systematic issue that we're one part of the puzzle, but we have to come together with business organization to address the root cause of the issue. And that starts in childhood.
Yes, Afaf. That was a phenomenal answer. And then we're just going to go ahead and close out with Kelly.
Okay, great. So before I can ask myself why a business or a corporation should care, I need to ask myself, what is my role in making my community safe, healthy, and strong? And do an assessment. What resources, expertise, and influence do I have to address these issues and create positive change right here in my community and breaking the cycle? Partnering with businesses and other community partnerships brings synergy to the work that I think is present in each of us. None of us can do it all. We need each other's creativity, expertise, and support, because we're stronger together. The stronger and more vibrant our communities are, the more likely our businesses are to thrive. So investing in our children is investing in our future.
Oh, I couldn't agree more. When you invest in children, you most definitely are investing in your future. TMH, that was a wonderful segment. We really appreciate you not only joining this webinar, but also what you're doing across the state of Florida. So if we go ahead to the next slide, this webinar would not have been possible without our Board of Equality of Opportunity Advisory Board members. When we talk about community involvement and collaboration, this is a prime example. They are not only our thought leaders, but they are committed financially to our mission. And on this next slide, once again, we want to continue this conversation at our upcoming Prosperity Solution Summit that is happening May 23rd in Coral Springs, Florida. We're coming to you, Fort Lauderdale, Broward County. I believe that's right. And then also your 2024 Florida Learners to Earners Workforce Solutions Summit, which will be June 26th in Tampa, Florida. We have some QR codes for you all to go directly there to go ahead and register. And then also, we want to say thank you for each one of you all tuning in to today's webinar and offer you a 10% off in-person registration promo code. Make sure you use RCM24 at checkout. Stay tuned. We'll have a follow-up email for you all to engage in our upcoming webinar that'll be happening in April. But until then, stay engaged, reading our opportunity insights, and by visiting our website, floridachamber.com, and share your promising practices with us so that maybe you can be joining us the next time as a panelist. Thank you for spending time with us, and have a wonderful day, everyone.